Prevention of communicable diseases should be considered in various aspects, including personal hygiene, food hygiene, environmental hygiene, and vaccination. Personal hygiene includes hand and respiratory hygiene. Hand hygiene is very important for preventing the spread of communicable diseases, as many are transmitted through contact. The following areas inside schools and centres, such as toilets, kitchen, pantry, laundry, and art room, liquid soap, disposable paper towels, or hand dryers should be provided. Wherever hand washing facilities are not available, 70 to 80% alcohol-based hand rub should be provided. Generally speaking, when hands are visibly soiled or likely contaminated with body fluids, hand washing with liquid soap and water is required. When there is no visible dirt on the hands, 70 to 80% alcohol-based hand rub can be used. Perform hand hygiene in the following situations: before touching eyes, nose and mouth, before eating and handling food, after using the toilet. When hands may be contaminated by body fluids, such as after changing diapers for a young child, handling blood or articles soiled with body fluids. When hands are contaminated by respiratory secretions, such as after coughing or sneezing. After touching public installations or facilities such as escalator, handrail, lift buttons and doorknobs. Respiratory hygiene. No spitting. Cover nose and mouth with tissue paper when coughing or sneezing. Wrap up respiratory secretions with tissue paper. And then discard into a garbage bin with the lid. Or flush it away in the toilet. And wash hands immediately. Person with symptoms of respiratory infection should wear a mask to prevent the spread of germs. Food hygiene covers 3 aspects: choosing, preparing and storing food. Buy fresh food or pre-packaged food which is labelled with an expiry date and has intact packaging. Don't overstock food to avoid prolonged storage. When handling raw and cooked food, separate knives and chopping boards should be used to prevent cross-contamination. Wash hands properly after handling raw food. Do not handle cooked food with bare hands. Wear mask, washable or disposable apron and cap when handling cooked food. Wounds on hands should be covered with waterproof dressing. Staff should not handle food if suffering from illnesses such as fever, diarrhea and vomiting. Store food in well-covered containers. Perishable food should be stored in refrigerator immediately after purchase. Milk prepared in advance should be stored in a refrigerator at or below 4 degrees Celsius to prevent germ growth. It should be discarded if still not consumed after 24 hours. Each refrigerator should be equipped with a thermometer and has the temperatures recorded regularly. Keep the temperature inside the refrigerator at or below 4 degrees Celsius and the freezer compartment at or below -18 degrees Celsius. Besides, it should be cleansed at regular intervals. Germs can survive in the environment for a period of time, therefore environmental hygiene is also very important. When choosing a disinfectant, check its contents and directions for use. Household bleach containing 5.25% sodium hypochlorite is the most convenient and effective disinfectant. 1 in 99 diluted household bleach is adequate for general cleaning purposes. It could be used to clean and disinfect school premises, including classrooms, kitchens, canteens, toilets, bathrooms, and school buses, etc. Leave the bleach for 15 to 30 minutes and then rinse with water and wipe dry. Clean and disinfect frequently touched surfaces such as furniture, toys and commonly shared items such as doorknobs, handrails and computer keyboards at least daily. Since household bleach contains sodium hypochlorite, which is corrosive to metal, use 70% alcohol to disinfect metallic surfaces. If contaminated by respiratory secretions, vomitus or excreta, wipe the visible dirt away with highly absorbent disposable towels first. Then disinfect the surface and 2-meter neighbouring areas with 1 in 49 diluted household bleach. Leave the bleach for 15 to 30 minutes, then rinse with water and wipe dry. Blood-stained articles should be wiped with highly absorbent disposable towels dipped in 1 to 4 diluted household bleach. Leave the bleach for 10 minutes, then rinse with water and wipe dry. Clean regularly air conditioners and filters. Kitchen is the place where food is handled. It should be kept clean at all times. Exhaust fans and range hoods should be cleaned regularly. Eating utensils should be stored properly in clean cupboards. Worktops should be kept clean. Floors should also be kept dry after cleaning. And don't place any clothes or personal items in the kitchen. The garbage bin should be covered properly to prevent breeding of mosquitoes, cockroaches, flies, rats, etc. Toilets, changing rooms and bathrooms should be kept clean. Ensure flushing system of the toilets is functioning properly. Drain pipes should be installed with U-shaped water traps. Don't attempt any unauthorized alteration. Pour about half a litre of water into each drain outlet once a week so as to maintain the water column in the pipe. Ensure soil pipes and sewage drains are functioning properly without any leakage. Clean hand-washing basins and toilet bowls regularly. Rubbish should be wrapped up and discarded in garbage bins with lids. Wash hands immediately after handling garbage. Floor mops and wipers should be handled carefully. Used cleaning utensils should be rinsed with water to remove solid and bulky waste. Then, immerse them into 1 in 49 diluted household bleach. For 30 minutes, wash with clean water afterwards. Reuse after thoroughly dried. Maintain at least 1 meter distance between children's beds. Inspect and clean children's lockers regularly for food remnants so as to prevent breeding of pests and rats. Clean immediately if there are any signs of pest or rodent infestation. Empty water in saucers underneath flower pots and change water in vases at least once a week. Top up defective ground surfaces so as to prevent accumulation of stagnant water and breeding of mosquitoes. Avoid stacking of articles in schools and centres in order to prevent rodent infestation. It is not advisable to keep pets like cats, dogs, birds, etc. in schools and centres. Vaccination is important for prevention of communicable diseases. Parents should be reminded to have their children vaccinated according to the childhood immunisation programme recommended by CHP.